I will be talking about the call to action, how we can partner global and national efforts on obesity. Let me begin by stating a very grim reality that around the world, there are around 800 million people who have obesity. And so really, it is a global issue when you talk about obesity. And this problem of obesity did not just start the last 5 or even 10 years. In fact, since 1980, we can see that the prevalence of obesity started to increase all over the world. And comparing data from 2015 to 1980, over that period of 35 years, you can see that the prevalence of obesity has doubled in more than 70 countries. And these include not just countries who have low income, but even the high income countries have that pattern of increasing prevalence of obesity. And with the increasing number of people who develop obesity, we can see that there are also higher deaths due to cardiovascular diseases, cancers, chronic kidney disease, and even diabetes, which we all know are all related to high body mass index. This data is further supported by newer data, wherein when they looked at the different risk factors that contribute to death and disability life years, see that in 2019, the three factors that accounted for the most death and disability life years were high fasting plasma glucose, high body mass index, and ambient particulate matter pollution. And so you can see here that metabolic risk factors and environmental risks contribute to the death and disability of a lot of individuals around the world. Comparing data from 1990 to 2019, again, over a period of almost 30 years, we can see that in 1990, high body mass index was number 16 as far as the risk for developing or for contributing to death and disability. But almost 30 years later, what you will notice is that the cardiometabolic risk factors such as high systolic blood pressure, smoking, high fasting plasma glucose, low birth weight, and high body mass index have become the 5 leading risks globally for death and disability life years. And so we can see here that these metabolic and environmental risk factors indeed have significantly increased as the most important risk factors that lead to death around the world. And very interestingly, when you look at the percentage change in the number of DALYs from 1990 to 2019, see that it is in fact the high body mass index which has the greatest percentage increase as an attributable risk for DALYs for the last 30 years. And so, of the different metabolic factors, it is increasing percentage of obesity around the world that contributed to death and disability. This is data from all over the world. But how about here in our own country? We also have trends that started in way back 1993, care of the Department of Science and Technology and the Food and Nutrition Research Institute. And here we see the trend in the prevalence not just of chronic energy deficiency, but also of overweight and obesity among adults here in our country aged 20 years and above. And based on the most recent survey, the data that was published in 2019, we can see that using the World Health Organization BMI cutoff points, 36.6% of Filipino adults are either overweight or obese, which means 1 in 3 Filipino adults, based on the latest survey, is either overweight or obese. That is using, of course, the BMI cutoff. What if we use another parameter, this time a parameter that measures central adiposity, and that is waist circumference. When we talk about waist circumference cutoffs, using a cutoff of more than 40 inches for men and more than 34 inches in women, the prevalence of high waist circumference among Filipino adults, based on the most recent survey, is 23.3%, meaning that 1/4 of Filipino women have central adiposity that is excessive. Another parameter that if we will also use, which is also validated and is associated with higher risk of cardiovascular events, is the waist to hip ratio. And using a waist to hip ratio of more than 1 for men and more than 0.85 for women, we see that as much as 63% of Filipino women, based on the most recent survey, have an elevated waist to hip ratio. That is indeed a very high number. And knowing that this parameter is associated with the high risk of developing a first myocardial infarction based on the Interheart study, we must be worried that a lot of our population in women in particular are at high risk of developing a heart attack. No wonder that if we look at the leading causes of death in our country, based on the data provided to us by the Philippine Statistics Authority, and here I'm showing you data that are coming from the 2020 and 2021 estimates, we can see that the top 3 causes of death in our country are ischemic heart disease, cerebrovascular diseases, neoplasms, and you can see there that the 4th includes another non-communicable disease related to high body mass index, and that is diabetes. So indeed, these diseases, which are associated and related to high body mass index all over the world, are also the leading causes of death in our country in recent times, including the pandemic years 2020 and 2021. In fact, you can see there that after these 4 non-communicable diseases, it is COVID-19 virus-related deaths that became the 5th leading cause of death in our country. And so indeed, despite the pandemic, non-communicable diseases that are attributable to high body mass index and obesity continue to be the leading causes of death in our country. And in fact, if we look at the risk factors driving the most death and disability, coming from the Institute of Health Metrics and Evaluation, we can see that comparing 2009 to 2019, and these are data for the Philippines alone, we can see that there are very common risk factors that we see that are also associated with the global increase in DALYS. And this include, of course, hypertension, elevated blood pressure, dietary risks, high fasting plasma glucose, and high body mass index, as you can see there, as included in the 10 leading risk factors driving the most death and disability here in the Philippines, particularly for 2019. And looking at the percentage change as what we also saw in global data, clearly you can see that it is the high body mass index that gives you the greatest percentage change in risk factors driving the most death and disability over 10 years here in the Philippines. So, isn't it very important now for us to consider obesity as a very important risk factor to concentrate on if we want to reduce death and disability, not just globally, but more importantly, here in the Philippines? And thus, it now brings us this very important concept that we must look at obesity not as a risk factor for other diseases, but as a disease in its own right. And in fact, it has already been recognized as a disease in its own right by several organizations, including the World Obesity Federation. And the WOF, in fact, defines obesity as a chronic, relapsing, progressive disease, and that it results in metabolic consequences from the cytokines that are released from fat cells and the inflammatory environment that the individual is in. And thus, the main organ that is really involved in disease causation of obesity are the adipose tissues. And that if you have excessive fat accumulation in your adipose tissues, these are the ones that drive now the release of the different cytokines that lead to the different manifestations of obesity. And thus, it is important that we recognize this not just as a risk factor, but as a disease in its own right. And that is the reason why the World Obesity Day was established. In 2015, it was established as an annual campaign with the goal of stimulating and supporting practical actions that will help people achieve and maintain a healthy weight and reverse the global obesity crisis that we have seen based on the data I have shown you a while ago. So in 2020, they had the first United World Obesity Day, establishing a single awareness day among diverse stakeholders, and it was set as March 4 of every year, being the World Obesity Day. And last year, the theme for the World Obesity Day was Everybody Needs Everybody. And this awareness campaign wanted to reach audiences around the world so that we must be able to inculcate obesity as a disease and awareness of this disease. And for this year, 2022, the theme is Everybody Needs to Act, in order to now encourage everyone to action at the local, national, and global level. And so for today, we are celebrating World Obesity Day, March 4, 2022, and our theme is Everybody Needs to Act. And in fact, this is an action that is initiated by the World Obesity Federation and is echoed by all the other obesity organizations around the world. We want to spread the word that everybody needs to act about obesity, and that we can see here that we also can share our stories and our plans. And that is the reason why I am sharing you now in this part what the PASOO, or the Philippine Association for the Study of Overweight and Obesity, has been doing and is doing in order to address this disease which we call as obesity. We know that we should act together as what is the theme for this year. And that is why in PASOO, we don't have just physicians, endocrinologists, but we also have psychiatrists in order to look at the behavioral aspect of management of obesity. We have the nutritionists, the dietitians, of course, very crucial in giving us dietary advices. We have our physical fitness experts and the academicians who are also able to give us the science behind physical activity for weight management. And we have colleagues who are able to address special populations. We have cardiologists in our team. We have pediatricians in our team in order for us to address special populations of individuals who are also at risk for obesity and its complications. And so we work as a team at the PASOO in order to provide information, education to colleagues, not just physicians, but also the lay. And as evidenced by in recent webinars wherein our past president, Dr. Mia Fojas, together with Professor Hercules Calianta, was able to share information to the lay, to the DTI in particular, the Consumer Policy and Advocacy Bureau, in order to educate them on the healthy diet during the COVID-19 pandemic and how physical activity can also be incorporated during the COVID-19 pandemic. And as part of the World Obesity Day activities of the PASOO leading to this day, we had collaborations with media, our partners in radio, particularly in the DWIZ, with Ms. Maru Pahati Sarne. We were able to schedule 4 interviews on issues on obesity starting last February 9 with Dr. Anne Marie Ting talking about obesity in children. Yours truly last February 16, wherein we talked about obesity in adults. In February 23, we had Dr. Celeste Tanchoco talk about dietary interventions to combat obesity. And just last March 2, we had Professor Calianta talking about physical activity for weight management. And on March 6, we will again have this interview with the program of Bernadette Sembrano and Alvin El Chico. Thank you, Doc, to talk about overweight and obesity. So I encourage and enjoin you to stay tuned for this program on the morning of March 6 at 8:30 so we can talk about overweight and obesity as part of our World Obesity Day celebration. But not only are we educating people, our colleagues and the lay, not just by scientific lectures, postgraduate courses, and even conventions, but we also, as an organization, have come out with papers and even guidelines. One such paper was a white paper which in 2018 we published, and this is the white paper of the PASOO on the need for healthy lifestyle practices to achieve and maintain a healthy weight for everyone. And in this white paper, we were able to outline several means and strategies in order for us to prevent obesity. And we were able to come up with 11 strategies in this white paper, which we circulated in 2018. Before that, we also were able to publish the treatment recommendations on obesity here in the Philippines. Again, the authors are our 2 past presidents in the PASOO, Dr. Gabriel V. Hasul Jr. and Dr. Rosa Allen C. And this was published in the Journal of the ASEAN Federation of Endocrine Societies in 2011. We all know, however, that after 2011, a lot of studies have come out, and using new evidence, we can now create new guidelines for obesity management here in our own country. And so, in response to the request of the Department of Health for clinical practice guideline topics for DOH funding, we submitted our proposal for the Philippine Clinical Practice Guidelines for the screening, diagnosis, and treatment of obesity and we are awaiting the result of our proposal to the Department of Health. And this is, of course, as answer as well to the Universal Healthcare Act. Not only do we do things as an organization in PASOO, but what we want to do is to collaborate. And collaborating not just with government agencies, but also with several organizations is one way of engaging everyone. And so, consistent again with the theme that everybody needs to act, the PASOO, together with other groups, and specially headed by the National Nutrition Council, drafted a national policy on addressing overweight and obesity, and we're just waiting for this to be approved and finalized so that everyone will be aware of this governing board resolution on the national policy addressing overweight and obesity, so that we will all be guided on how we can move forward to address this disease, which is obesity. And of course, being World Obesity Day today, we have actually released a joint media release together with the Department of Health, the National Nutrition Council, the Nutrition Center of the Philippines, the World Health Organization, and the United Nations Children's Fund, or UNICEF, in order to raise the alarm on the growing obesity problem in the Philippines during this occasion of the World Obesity Day. And we do hope that you will be able to read this joint media release, which we have released today as part of the World Obesity Day activity in collaboration with all these organizations. And so, what have we done? We have been very active and we are very supportive of the initiative of the World Obesity Federation. For those of you who might not be familiar, the World Obesity Federation was formerly the International Association for the Study of Obesity, or the IASO, and now it is the World Obesity Federation, and this is their website. And we are happy that the PASOO, the Philippine Association for the Study of Overweight and Obesity, is a member of the World Obesity Federation. And because we are a member of the World Obesity Federation, we are one with them in celebrating the World Obesity Day and encouraging everyone to be together in order to combat obesity. And here we have the picture of the Board of Trustees of the PASOO giving you this sign of the World Obesity Day. Everybody needs to act. And we're so happy that we are joined not just by the members of the Board of Trustees of the PASOO, but we also have prominent personalities that have joined us in greeting everyone and ensuring that everyone is properly informed of obesity and its consequences, and that we should address this as a disease. I'm sure you can recognize these familiar faces. And where can you hear and listen to what they have to say about obesity and how we can combat this disease? You can see their videos in our social media handles. And so I would like to invite you to like our Facebook handle, our Twitter handle, our Instagram account, and soon we will also have our very own PASOO official YouTube channel. And so everyone, if you'd like to listen to what Heidelin Diaz has to say, of course, our very first Olympic gold medalist, please like and share our social media pages that you see here in the slide. With that, I would like to thank everyone and tell everyone that we do have a lot of initiatives locally that echo the global call for proper obesity education and proper obesity information dissemination. Thank you very much.